Hello, my dear friends. I want to begin today by asking you something very important, and I hope you will take a moment to really think about your answer. Have you noticed a tingling sensation creeping into your feet lately, perhaps when you are sitting quietly in the evening? Maybe you have been waking up in the middle of the night with muscle cramps that seem to come from nowhere. Or perhaps by the end of the day, your legs feel unusually heavy, as if you have been carrying an invisible weight. If any of these experiences sound familiar to you, please stay with me for the next few minutes. What I am about to share with you could make a real difference in how you feel every single day. These sensations you might be experiencing are not simply the inevitable price of growing older. They are actually your body's gentle but important way of telling you that your circulation system may need some caring attention. My name is Lee, and I have spent many years working alongside seniors just like you, helping them understand what their bodies are trying to tell them. I have seen too many wonderful people dismiss important warning signs, thinking they just have to accept discomfort as part of aging. But that is simply not true, and today I want to share some hope and very practical solutions with you. Why understanding your circulation truly matters. You know, circulation problems have a way of developing very quietly, almost like a whisper that gradually grows louder. What might start as just a little swelling in your ankles or some minor discomfort in your legs can slowly transform into chronic pain that affects your daily activities, deep fatigue that makes simple tasks feel overwhelming, or even difficulty walking the distances you once enjoyed with ease. In more serious cases, and I do not want to frighten you, but I do want you to be informed, poor circulation can lead to dangerous blood clots, damage to the nerves in your legs and feet, or even increase your risk of stroke. These are not outcomes any of us want to face. Here is what concerns me most. Too many people wait until their symptoms become quite serious before they seek help or make changes. But you are here right now, listening to this information, which tells me something wonderful about you. It tells me that you are someone who takes responsibility for your health and wants to stay active and independent for years to come. The encouraging truth is that recognizing these early warning signs and taking natural, gentle action can help preserve the independence and active lifestyle that means so much to you. You have more control over this than you might think. What we will explore together today. Over the next several minutes, we are going to carefully examine 5 specific warning signs that your circulation system might be struggling. I will explain each one in clear, simple terms, and more importantly, I will share with you 4 specific vitamins that scientific research shows can genuinely improve your blood flow, strengthen your blood vessels, and protect your precious heart. Now, I want to reassure you right away that these are not expensive, hard-to-find supplements that will strain your budget. These are common, well-researched nutrients that many of you may already have sitting in your kitchen right now. These vitamins work by increasing the flexibility of your blood vessels, reducing your risk of dangerous clotting, and improving circulation to those important areas, like your legs and feet, that often need the most help. We will also be sharing some valuable insights from Professor Dr. Joel Espriger, who is recognized as one of Europe's leading experts in regenerative medicine. With decades of experience treating patients and hundreds of published research studies to his name, Professor Espriger emphasizes something very important. We should never dismiss circulation symptoms as simply part of getting older. Before we dive deeper into this important information, I would love for you to take just a moment to comment below with your age and the area where you live. I genuinely enjoy seeing our growing community of people who, like you, choose to take an active role in protecting their health as they age gracefully. Understanding how your circulation system works. Let me help you picture your circulation system in a way that makes it easy to understand. Think of your circulation like a vast highway system that runs throughout your entire body. Your blood travels along these highways, working tirelessly to deliver life-giving oxygen and essential nutrients to every single cell in your body, from the top of your head to the tips of your toes. When this highway system is working smoothly and traffic is flowing well, you feel energized, strong, and ready to take on your day. But when circulation begins to slow down or encounters roadblocks, that is when problems start to develop, and you begin to feel the effects in ways that can really impact your quality of life. Poor blood flow typically happens when your circulation becomes sluggish, or when certain pathways become partially blocked, especially in areas that are farthest from your heart, like your feet and legs. Several factors can contribute to this situation, and understanding them can help you take positive action. These factors include the buildup of plaque in your arteries, weakened valves in your veins that are not doing their job properly, high blood pressure that puts extra strain on your system, diabetes that affects your blood vessels, lack of regular physical activity, smoking that damages your circulation, or simply the natural changes that can come with aging. When blood flow becomes weakened, oxygen and nutrients struggle to reach your cells the way they should. This creates what doctors call a cascade effect, where one problem leads to another. You might experience pain when moving around, muscle cramps that disturb your sleep, numbness or tingling sensations, skin that feels unusually cold, wounds that heal much more slowly than they used to, and in serious cases, the formation of potentially dangerous blood clots. What makes poor circulation particularly concerning is how quietly and gradually it can develop. Many people dismiss symptoms like cold toes or swelling in their legs as just normal signs of aging. But these symptoms are actually your body's way of signaling that your vascular system is working harder than it should and may need some support. As Professor Espreger states very clearly, proper blood flow is absolutely essential to every aspect of healing and vitality in the human body. When circulation is compromised, nothing else can function at its best. But here is the truly encouraging news that I want you to hold on to. Poor circulation can often be significantly improved or even reversed when it is caught early and addressed properly. Simple changes in your daily routine, combined with natural vitamin support, can help restore proper balance to your blood vessels and get you feeling better again. The 5 critical warning signs you should never ignore. Sign 1. Changes in skin color in your legs and feet. Have you looked down at your ankles or feet recently and noticed that they appear unusually pale, have taken on a bluish tint, or show dark patches that were not there before? These color changes are your skin's way of telling you that it is not receiving enough oxygen-rich blood, which indicates that blood flow to these areas has become reduced. You might also notice that these areas feel noticeably colder than other parts of your body, even when you are in a warm room. This is another clear sign that blood is not reaching these areas as effectively as it should. Additionally, if you have any cuts, scratches, or blisters in these areas, you may find that they heal much more slowly than they used to, which can, unfortunately, open the door to infections and other complications that nobody wants to deal with. Sign 2. Cramping during walking or painful night spasms. Sharp, intense cramps in your legs during walking that force you to stop and rest may be a sign that your leg muscles are not getting enough oxygen to support your activity. Doctors have a specific name for this condition, intermittent claudication, and it is a fairly common sign that the arteries in your legs have become narrowed and are not allowing proper blood flow. Many people also experience painful muscle spasms during the night that jolt them awake and disrupt their sleep, leading to daytime fatigue and affecting their overall quality of life. While massaging the affected area might provide temporary relief, the real underlying cause is often poor circulation that needs to be addressed. Sign 3. Frequent tingling sensations and numbness. Those pins and needles sensations in your feet and legs, especially after you have been sitting or standing in one position for a while, should not be quickly dismissed as simply the result of poor posture. When these symptoms become frequent or persistent, they often suggest that your nerves are under stress due to insufficient blood flow reaching them. Over time, if this condition continues without attention, it can potentially lead to peripheral nerve damage, which can slow down your reflexes, dull sensation in your feet, and even affect your balance and coordination. These are early warning signs of circulation-related nerve problems that deserve your attention. Sign 4. Persistently cold feet. Even on warm days. If your feet remain cold even when the weather is warm and everyone else around you is comfortable, this is a clear signal that blood is not reaching your extremities as effectively as it should. This typically happens when blood vessels have become narrowed, hardened, or partially blocked, preventing the warm, oxygen-rich blood from reaching your feet. Beyond the simple discomfort of having cold feet, this reduced blood flow also weakens your feet's natural ability to defend against injuries and infections, making you more susceptible to cuts that do not heal well, infections that are harder to fight off, and other complications that can really impact your mobility and independence. Sign 5. The appearance of varicose veins and spider veins. Those bulging, twisted veins that appear bluish or dark purple on your legs are very clear, visible signs that your circulation system is struggling. These varicose veins develop when the small valves inside your veins become weakened and can no longer do their job properly, which allows blood to flow backward or pool in your lower limbs instead of returning efficiently to your heart. This pooling creates pressure that stretches and damages the walls of your blood vessels, leading to the discomfort, swelling, and that heavy feeling in your legs that can make even simple activities feel more difficult. Even the smaller red or purple spider veins that might appear are signs that your vein health has become compromised and could benefit from attention. Professor Espreger offers this important warning. The biggest mistake people make is thinking these visible signs are merely cosmetic issues. Poor circulation is like a silent unraveling of your vascular system. When circulation fails completely, the complications become much more difficult and expensive to treat. If you recognize multiple symptoms in yourself, I strongly encourage you to consult with a vascular specialist who can properly evaluate your condition. A simple, painless ultrasound examination can identify circulation problems before they become dangerous or require invasive procedures. Taking early action gives you the best possible chance of improvement through natural, gentle methods. 4 essential vitamins that can transform your circulation. Vitamin B3. Niacin, your natural blood flow enhancer. Niacin works like a gentle, natural mechanism that helps expand your blood vessels, making it much easier for blood to flow freely throughout your body and significantly reducing your risk of dangerous clot formation. This expansion allows much more oxygen and essential nutrients to reach your tissues, which can provide real relief from leg fatigue and those uncomfortable cramping sensations. Niacin also acts as a champion for your heart health by naturally lowering harmful LDL cholesterol while raising beneficial HDL cholesterol levels. This important balance helps prevent the buildup of plaque in your arteries, keeping your blood vessels flexible and healthy for years to come. You can find excellent sources of niacin in skinless chicken breast, eggs, salmon, tuna, and almonds. Just a 100-gram serving of chicken breast provides more than half of your daily niacin needs. While niacin supplements do exist, taking too much can cause an uncomfortable skin flushing reaction. For safety and effectiveness, it is much better to get your niacin through delicious, wholesome foods. Vitamin C, your dedicated vessel protector. While most people know that vitamin C supports immune system health, what many do not realize is that this powerful vitamin also plays a crucial role in strengthening the walls of your blood vessels and maintaining their natural elasticity. This function is absolutely vital for maintaining steady, healthy blood flow to your lower limbs. Vitamin C is essential for producing collagen, which is the important protein that provides structural support to your veins and arteries. When you have adequate collagen, it helps prevent blood vessel damage and can even help prevent the development of varicose veins. Additionally, vitamin C has natural anti-inflammatory properties that can reduce swelling and that heavy feeling in your legs. You can find abundant vitamin C in citrus fruits like oranges and grapefruits, kiwi fruit, all types of berries, and guava. Vegetables like broccoli, red bell peppers, and spinach are also excellent sources. For the best results, try to eat these foods fresh, as vitamin C can lose its potency when exposed to light and air for extended periods. Vitamin K, your dedicated artery guardian. Vitamin K is often overlooked, but it plays an absolutely critical role in managing your blood's clotting ability, helping to prevent both excessive bleeding and the formation of dangerous clots. Just as importantly, Vitamin K helps prevent arterial calcification, which is the process where calcium deposits can harden your blood vessel walls and make circulation more difficult. This protective function is especially vital for people who have high blood pressure or visible varicose veins. Vitamin K helps maintain clearer, more elastic blood vessels that can much better support healthy blood flow throughout your body. You can get plenty of vitamin K from dark leafy green vegetables like spinach, kale, and broccoli. One delicious way to increase your intake is to try morning green smoothies that combine kale, apple, celery, kiwi, and a little fresh ginger for flavor. If you are currently taking blood-thinning medications like warfarin, it is important to maintain consistent vitamin K intake so your doctor can properly adjust your medication dosages for your safety. Vitamin E, your powerful antioxidant shield. Vitamin E acts as a powerful protector for your blood vessels, shielding them from oxidative stress that can cause aging and weakening over time. It works by neutralizing harmful free radicals that can damage your cells, thereby preserving the integrity and flexibility of your artery walls for better long-term health. This remarkable vitamin also helps prevent the formation of blood clots while actively promoting smooth, healthy circulation throughout your body. Additionally, vitamin E enhances your body's production of nitric oxide, which is a natural substance that helps your blood vessels relax and can naturally help lower your blood pressure. You can find excellent sources of vitamin E in avocados, extra virgin olive oil, sunflower seeds, pumpkin seeds, almonds, and green vegetables. While vitamin E supplements are available, taking excessive amounts can actually increase your risk of bleeding. For the safest and most effective results, it is much better to rely on whole foods that provide steady, gentle absorption, bringing it all together for better health. These circulation issues we have discussed today are not minor annoyances that you should simply learn to live with. They are often early signals of deeper health problems that can eventually affect your heart, your brain, and your ability to move around comfortably and independently. Symptoms like numbness in your toes, painful night cramps, pale or discolored skin, and heavy feelings in your legs are your body's important warning system trying to get your attention. The wonderful news is that you do not need to take drastic measures or spend a fortune to make a real difference in how you feel. Thoughtful daily changes combined with natural vitamin support from wholesome foods can dramatically improve your circulation and help protect you against more serious conditions developing in the future. Let me give you a quick recap of your circulation-supporting vitamin team. Vitamin B3 enhances blood flow throughout your body and helps balance your cholesterol levels for better heart health. Vitamin C strengthens your blood vessels through collagen production and reduces harmful inflammation. Vitamin K keeps your arteries clear and flexible while preventing dangerous clot formation. Vitamin E shields your blood vessels from damage and promotes natural relaxation for better blood flow. Together, these 4 vitamins create a powerful, natural support system for healthier circulation. The best part is that they all come from everyday, affordable foods that you can easily include in a balanced, enjoyable diet. Getting started on your path to better circulation. The key to success is starting simply and building gradually. Begin by really listening to your body and taking note of any unusual sensations or changes you might be experiencing. Then start making easy, sustainable food swaps in your daily routine. Try beginning your day with a nutritious green smoothie packed with circulation-supporting nutrients. Replace packaged snacks with a handful of nuts and seeds that provide natural vitamin E. Make an effort to add more leafy green vegetables to your meals for that important vitamin K. Choose fresh, colorful fruits over processed sweets to boost your vitamin C intake naturally. These small daily changes might seem modest, but they build the foundation for significant health improvements over time. Remember, consistency is much more important than perfection. If you are currently experiencing symptoms, have a family history of circulation problems, or are taking any medications, I strongly encourage you to discuss this information with your healthcare provider. They can help tailor specific advice to your individual needs and ensure that any changes you make are safe and effective for your particular situation. Taking good care of your circulation means so much more than just addressing uncomfortable symptoms. It means preserving your independence for years to come, improving the quality of your sleep and your daily energy levels, and maintaining that precious peace of mind that comes from knowing you are doing everything you can to stay healthy and strong. When you make these positive changes in your life, you are not just addressing current concerns, you are making a valuable investment in many vibrant, active years ahead, and ensuring that you will have more time and energy to spend doing the things you love most with the people who matter most to you. If this video has helped you better understand your health and given you practical steps you can take starting today, I would be so grateful if you would share it with someone else who might benefit from this information. Knowledge like this can truly change lives and even save lives. Thank you so much for taking the time to watch and learn with me today. Please take a moment to like this video and subscribe to our channel if you found it helpful. Your support helps us reach more people who, like you, are seeking to stay strong, healthy, and independent as they age gracefully. I would love to hear from you in the comments below. Please share your age and location with us. I truly enjoy hearing from our amazing community of health-conscious individuals. Remember, better circulation and better health start with small, manageable steps that you can take today, right now. I look forward to seeing you in our next video, where we will continue exploring ways to help you live your healthiest, most vibrant life. Until then, take care of yourself, and remember that every positive step you take matters.